Setting goals. There is an important relationship between treatment plans and goals. Treatment plans are essential and often required tools that provide a map to assist our clients on their journey. The treatment plan addresses problems identified in the client assessment, defines and measures interventions in care, and provides a measure for clients' progress in treatment. Treatment plans are key in demonstrating the effectiveness of our interventions to our clients, as well as to accrediting bodies and/or third-party payers. The treatment plan should contain some important features, including clearly defined problems and need statements, measurable goals and objectives, frequency of care, treatment, and services, as well as outcomes. The treatment plan should define objectives that are specific so that we can evaluate the client's progress, and goals and objectives should be reevaluated when necessary and revised at a minimum specified time interval that is established by the agency or organization. A goal is a statement that describes, in broad terms, what the client will learn from a particular treatment or what change is desired. The first stage of therapy must be devoted to clarifying the specific problems that a client brings, and then translating these problems into well-formed goals. You might find it helpful to use the SMART system of goal setting, an acronym that can help you remember the qualities of effective, well-formed goals. SMART stands for specific, measurable, attainable, realistic, and timely. Well-formed goals are specific. What exactly does the client want to accomplish? The more specific the goal, the better the chance we can figure out what needs to happen to achieve it. Well-formed goals are measurable. Unless a goal is measurable, we have no way to determine if you're making progress. Generally, how the client feels or how we feel that sessions are going is a poor way to measure progress. Feelings fluctuate a great deal, and sessions can also fluctuate in how successful they feel or not. Well-formed goals are action-oriented and attainable. The client's goals will be more useful if you're able to determine the specific actions that must be taken to make headway towards the improvement. Well-formed goals are realistic. Setting unrealistic goals is counterproductive, and it leads to a sense of defeat. Well-formed goals are timely. It can be useful to attempt to develop a time frame for a goal, or the steps involved in achieving the goal. This helps you to determine if you are on track, or if the client is sufficiently committed to the requirements of the goal. Having a time frame will help you and the client focus and will give you a certain motivational challenge, thereby mobilizing resources. In SMART goals, specific answers the what, when, how, and why. Measurable answers, when will we know the goal is accomplished? Attainable answers, where are you now and where do you want to be? Realistic means that the client is willing and able to accomplish the goal. It's within reach. It may not be easy, but it's realistic that I can get there. It's attainable and realistic. Timely answers, when exactly are the goals or objectives expected to be completed? Here are some examples of smart and not so smart goal setting. This specific example comes from working with a child. A non-smart goal is to improve communication. Well, how are we going to know that? How are we going to go about accomplishing that? When do we want to see change accomplished by? So, non-smart goals kind of lack the detail needed to know when do we really know that this is going to happen and how do we know how we're going to get there? The SMART goal would be make 10 requests for items using visual support in a therapy session by this specific date. Without specific goals, therapy is less likely to be effective. Discussions will be diffuse and lack focus, and will tend to drift from topic to topic without really accomplishing anything. Often, if there's a lack of focus, there's more of a likelihood to focus on the past events, external situations that we often have little control over, or just kind of the overwhelming emotions that we might be feeling. Although clients may obtain some relief from venting, we'll be unlikely to make any significant changes if we don't set goals. To maximize the effectiveness of therapy, we need a clear sense of where we're trying to get to and the incremental steps that we need to take to get there.